Congressman Price, thanks for being with us.
Good morning. Great to be with you. Thank you.
I've got Boehner's letter to the White House yesterday, and he's asking the president to start from scratch, start all over again. All signals from the White House are, no way, not going to do it. So what's the point?
Well, I don't know that it's just the Republican leaders' proposal to start from scratch. It's the American people's demand. What they have said is that they aren't interested in a government takeover of health care, that they believe we need to step back and start from ground zero. Make certain that we move forward in a positive, productive way, in a bipartisan way,
but they're not going to do
in a way
it.
That respects patients.
But they said they're not going to do it, so what's the point? Isn't it a little bit silly? I mean, this has been an intractable problem for not just several months and last year, but for years, for decades. To think that somehow a half-day televised summit can reach any meaningful resolution is preposterous, isn't it?
Well, and that may absolutely be, and that bleeds into the cynicism that the American people have, because they understand that this is most likely just another photo op for the president. What we demand of the president, what we ask of the president, is to truly go about this in an honest and an open and a deliberate way, so that we can bring the ideas to the table and move forward with a patient-centered system, not one that rewards government and allows the government to be dictating our most very personal medical decisions.
Well, look, maybe you're being set up, Congressman. Are you concerned that the president is trying to portray Republicans as obstructionists? He wants to put perhaps you on the defense, reframing the debate. He's the guy with all the ideas, and Republicans are bereft of ideas.
Well, he knows that's not true, and that's what I pointed out at our retreat. And he may be trying to set us up, but the fact of the matter is that the problem that he has is with the American people. The problem that he has is that the proposal that the Democrats have put on the table is objected to by the vast majority of the American people, which is why we need to start again.
What are
we need
the
to move back to square
ideas?
one.
If you are not bereft of ideas, what are your ideas?
Well, I shared them with the president at that retreat, and he mischaracterized it. But we believe that individuals ought to be able to get the health coverage that they desire for themselves and their family, not that the government wants for them. And you can do that through a series of tax deductions and credits and advanceable credits. You can get everybody covered with the insurance that they want.
Everybody?
You've got to solve the problem of everybody covered that desires to have a health coverage. Again, it's not a mandate from the federal government, but you can get people covered through a series of tax deductions and credits and advanceable credits. You have to solve the insurance challenges. You ought not lose your insurance if you change your job or you lose your job.
How about competitive interstate sales? Would you advocate that?
Absolutely.
What about coverage that cannot be terminated due to illness?
We ought to end the practice of pre-existing illnesses and injuries, but do it through a way that allows people to pick the insurance that they want, not the government dictating it to them. The way that you do that is to expand not just high-risk pools, but ability to purchase the health coverage that you want with the purchasing power of millions across this land.
Portability of plans, yes or no on that?
Absolutely. But the way that you do it, again, is to make it so that individuals can take their health coverage with them when they change their job or they lose their job. The way that the president wants to do it is to dictate to employers and to individuals what they must have.
All right. Well, there are 5 ideas you have suggested. Congressman Tom Price, thanks very much.